And welcome back. Well, have you ever heard of Popcare? It's healthcare on demand in an emergency. It's also local and community-based.
So how does it work, and does insurance cover it? Will they treat kids? Here with all the answers, Dr. Neal Harmelink and Irma Doering, both with Popcare. Great to see you both.
Thanks for being here.
Thank you so much. Never heard of Popcare before, and this is the first of its kind, right?
Yes, it is. It's the very first one, Popcare. It's a unique name, but you remember it. So, yeah, we're basically a full functioning urgent care that provides excellent care. You can schedule your appointment online. There's no really any waiting times right now. So we're located in Franklin.
Okay.
Yeah, we're 1 block south of College, very near the airport.
Yeah.
Okay.
So what are the hours? How does it work, and especially with no waiting times like that?
Yeah, the hours are very convenient. Monday through Friday, it's 9 a.m. to 9 p.m., and then Saturday and Sunday, 9 to 5.
Wow.
Fantastic.
Yeah.
How does it work? Because you're an ER physician, right?
Correct.
So usually when people think of that, they think of going to a hospital and there's an emergency room. And then people are sort of familiar with the concept of urgent care when you can go to a clinic that has maybe extended hours or is open on the weekend. So where does Popcare fit in with those concepts?
Right. Popcare is somewhat unique in that we are staffed by all practicing, experienced emergency physicians, emergency physician assistants, and nurse practitioners. So all of us practice locally in other emergency departments, but Popcare, I think the difference is, you know, we are used to seeing patients in the emergency setting, but then can provide it in a more comfortable setting, urgent care setting, where our specialty is really efficiency, seeing patients quickly, you know, certainly providing it at a value. Emergency rooms are very expensive.
Yeah.
We can see a lot of the things that you might go to an emergency room, but for a fraction of the cost. Typically, in an urgent care setting, costs for us typically run about 1/4 of what they might cost in an emergency room setting.
Wow. 25% of what you would pay to visit an ER.
We can save you that expense, still see you efficiently, get you in and out without a wait. Some places have very long wait times, and so our focus is to be there for you when you need us and save you that expensive visit to the emergency department.
What kind of services do you offer then? If somebody, is it the same as any other urgent care or emergency room?
Yeah, the services we offer are anything from the common cold to if you have a fracture, sprain, we have x-ray on site. So radiology's there. You can even leave with your prescriptions. So if you need an antibiotic for a typical sinus infection, you can go home with your antibiotic for a small price, or you can go to your pharmacy. It's all about convenience.
Yeah.
So yeah, we see just about anything.
It seems that it's a new trend in medical and healthcare is making it more convenient for patients. And I think a big concern for a lot of people these days is insurance and coverage. Do you take insurance at Popcare?
Yeah, so we do bill as an urgent care, and these are always difficult questions to answer because people have different insurances, different co-pays, different deductibles. What I like to tell people is our prices are, you know, very comparable to what it would cost to go be seen at a primary care office for a simple complaint. That it's 1/4 typically of the cost or less of an expensive emergency visit. And then we try to walk patients through that a little bit. If they call and want to know more, we try to say, okay, well, what is your insurance? Do you know what your deductible is? And we try to sort of help them navigate that so that there aren't surprises down the road. But I think I sleep comfortable at night knowing that our prices are going to, at the end of the day, I think, be a lot more reasonable than they might be somewhere else.
That gives a lot of peace of mind. How do you know the difference between when you should go to an ER versus an urgent care as a patient?
I think, for example, if you're thinking you might need an ambulance to take you in, you probably don't want to come to an emergency room or to an urgent care. But emergency room visits, if you have severe chest pain, you think you might have stroke symptoms, real severe difficulty breathing. The nice thing about Popcare is we are emergency providers. If you don't know, you can call us and ask. We're glad to help people navigate when we don't think we can provide the services in an urgent care. They need an emergency room. We make sure that they they know that we'll help them get to the right place.
You have all of it.
It's wonderful that people have this right here in our community. And right now, I think this is a wonderful offer, especially if you don't know what your blood sugar reading is or your blood pressure. It's good to have those things checked. And right now, December through February, Popcare is going to do free blood sugar readings and blood pressure checks. So be sure to mention the Morning Blend when you call. Here's the information for Popcare. You can also check them out online. It's 414-877-5445. They're located in Franklin, 1 block south of College. You can also go to popcareplus.com. Nice to meet you.
Thanks for being here.
Thank you so much.